Can I start, Vanessa?
Yes, go ahead.
Thank you everybody. Thank you to join us in this conversation about spirituality, faith and religion, creating time and space for connection, wellness and hope for healthcare and providers. So I will share with you a couple of information. You please keep your computer on mute. This meeting is recording. We will receive information about this meeting in 2 days. We will be able to access our video, and also we will be receiving a survey. Please answer the survey. It is important for us to give feedback from you. Your input matter for us. Just a little bit about the disclaimer. We are sponsored by SAMHSA, that is a Mental Health Transfer Technology Center. We are in New England region, and our grant number is in the bottom of this slide. So the MEHCC network uses to affirm respectful and recovery-oriented language, and our activities that we promote here. Our base stands in helpful, inclusion, healing through trauma. We always acknowledge your journeys. We are free of labels. We will not do any judgment and assumptions. Respectful, clear, and understandable. We are conscientious with our actions, policies, and products. The MEHCC New England mission is to use evidence-based practice. That means you are disseminate evidence-based practice across the New England region. Our area focus is on recovery and practice that include recovery support service with a context of recovery and system of care. Next, please. Our guiding principles, it's based on resilience and recovery, and we are working with these wonderful guidelines that probably we are familiar with. So again, welcome to our panel. That is a series that we are working through the well-being and recovery meetings. And please, we have been talking about defining spirituality, faith, and religion during this difficult time. We know that COVID-19 changed our lives, changed our way that we're working, the way that we connect with people. We went through a crisis that it's not familiar for us. And we are here to promote these conversations and hear from and listen to our presenters and participants, all the outcomes that we want to share. Next, please. So today we have the presenters, Reverend Hill, Robin Hendon, Reverend Benjamin, and Pastor Anthony, and our facilitators, Thomas Burr. So Thomas.
All right, thank you, Graciela, and welcome everyone. My name is Thomas Burr. I'm the Community and Affiliate Relations Manager for the Connecticut chapter of the National Alliance on Mental Illness. NAMI is an organization that provides support, education, advocacy, and awareness around mental health concerns and conditions for both caregivers and people living with mental health conditions. And I'm really happy to be here today to introduce to you our panel for this afternoon. And in no particular order, I'm going to introduce the four gentlemen who are going to be weighing in today. The first person I will introduce you is Reverend Hiram L. Brett. He is the Spiritual Care Coordinator and Chaplain at Connecticut Mental Health Centers, otherwise known as CMHC, in New Haven, and serves as a chaplain in the emergency room of Bridgeport Hospital. Prior to joining CMHC, he served as pastor of Whitneyville United Church of Christ in Hamden, Connecticut. Reverend Brett is a graduate of Yale Divinity School and Stanford University and completed his residency in clinical pastoral education at Yale New Haven Hospital. He has completed international federal level 1 and level 2 coach training and is working towards his professional coach certification. Our next panelist is Rabbi Randall Konigsberg. And for almost 40 years, Rabbi Konigsberg has been a spiritual leader and pastor in congregations in Florida, Minnesota, Alabama, and Connecticut. He graduated from the Jewish Theological Seminary in New York City with an ordination and an MA in rabbinic literature. He has worked as a hospital and police chaplain, as a rabbi for hospice, and as a rabbi for teens on the March of the Living history tour of Holocaust sites in Poland. He has trained in pastoral crisis intervention, education, cancer care, and substance abuse. He was awarded an honorary doctorate from JTS for his work in the Jewish community. And welcome, Rabbi Konigsberg. The next person I'd like to introduce is Dr. Benjamin Doolittle, who is also a reverend and is a local church pastor and a physician. He is an associate professor of internal medicine and pediatrics at Yale Medical School and associate professor of religion and health at Yale Divinity School. He directs the Yale program for medicine, spirituality, and religion, as well as the combined internal medicine-pediatrics residency program. And last and certainly not least, I would like to introduce to you Pastor Anthony C. Martin, who is worship director at Trinity Baptist Church in Arlington, Massachusetts. He is regional worship leader at the American Baptist Church of Massachusetts. And Anthony has a Master of Science and Bachelor of Arts in Music and Political Science at the University of Massachusetts, Boston. He is also the director of My Brother's Keeper, UMB Chapter Initiative in Boston. So welcome, gentlemen. Appreciate you taking the time out of, I'm sure, your busy days to join us today. And the format of this is going to be, I'm going to ask a series of questions and just kind of go around the room, so to speak, and ask the questions and ask each of you to weigh in on the particular question. And then when I go to the next person, I'll ask a different question, but I'm leaving it open. If there was something in the previous question or reply to the previous question that really resonated with you, I would ask you to weigh in on that as well. We are going to try to finish through the questions at about 10 after the hour, so approximately 3:10 Eastern time. And at that point, go into a Q&A. So without any further ado, I'm going to ask the first question of Reverend Brett, and that is, how important is spirituality and faith to our life during this pandemic?
Thank you, Thomas, and welcome everyone, and thank you for the opportunity to participate in this forum today. For me, I would say that spirituality and faith are critical and essential to our life during this period. I know for me, as the pandemic unfolded, I found that having the spiritual practices that I practice really made a difference in terms of my life and my ability to navigate through the pandemic. So I found myself becoming much more attuned to making sure that I was meditating, making sure that I was doing daily prayer, taking in practices of solitude and getting in nature. And I found that those types of practices helped me tremendously in the pandemic, as well as connecting with friends and family, even though we were isolated physically, trying to make those connections through Zoom and other means. So I think that having that kind of faith, having hope, faith and hope are just critical to being able to navigate through periods of uncertainty. So thank you.
And it certainly has been an uncertain time, so thank you for that. All right, my next question I'm going to pose to Rabbi Konigsberg. what experiences have most shaped your faith during the pandemic? And what is the message you'd like to share with your community? You're muted, Rabbi.
Thought I hit it. Yeah, it's that's the experiences. I mean, every day was an experience. Every day was something new. Every day was something different. In some ways, that's a clergy's life. I mean, we never know what's going to happen to us from day to day. We live our lives thinking, well, we got all this stuff planned, but in a minute it could all disappear. So when COVID came and everything disappeared, my main thing was trying to figure out how I could bring some kind of a spiritual message, how to keep people in contact with spirituality during this time, and Zoom was one of the things that I used, but also finding other means by phone or by staying connected, finding ways to stay connected with some of the older people that I was working with who aren't very tech savvy. Zoom was just beyond their capacity. And so I just took to creating a list of people who just needed to be contacted just so they wouldn't be in isolation. I created, so I found myself spending a lot of time on the telephone and a lot of time doing Zoom meetings and Zoom classes and trying and gathering people together for lectures, just so that people could feel not just the sense of spirituality and sense that we were still reaching out to them, but also for them to be a community. And one of the things that I did was I generally started my Zoom meetings early and left them running late so people could talk to each other. Just so that after when it was done, people could talk to each other and share something. It was public, but just so that they would feel like that their friends were still around and they could still be in touch with them.
No, exactly. And certainly the isolation aspect of the pandemic is something we were greatly concerned about at NAMI. And it did do a real number on some folks' mental health. So the fact that you were able to connect in the various ways, whether through phone or Zoom, I think probably made a huge impact. One you'll probably never be able to quantify, but still a huge impact with your congregation. So
you had to reach out. You just had to reach out to people, and because everybody was lost, and you became the lifeline and showed them how to stay, how we could still be a community.
No, exactly. So thank you for that. All right, my next question I'm going to pose to Dr. Benjamin. And how does one find balance between loss and well-being?
Boy, you gave me the easy one. I'd want to defer to the buddies, the good colleagues on this panel. How does one find balance between loss and well-being? The only way to do that is through love, I think. And it struck me that love and suffering are different sides to the same coin. And with all that we lost, we felt that, right? We grieved that because we care, right? We love. And I think, boy, as we emerge from this pandemic, which isn't over, but as we emerge from it, reconnecting through love and friendship, I just think that's the only way. I'm a physician and I served on the COVID floors, and I'm a pastor, trying to figure out what to preach on every Sunday. And I think if I can, I think our religious organizations are the antidote to a lot of this angst and loneliness and suffering that the world has experienced. And I know we live in a postmodern or post-religious or post whatever it is. We're post something, right? But it's so refreshing, to come back to, in my experience, a church, right? I'm a Christian pastor. To come back to worship in person was so refreshing and so revitalizing. So I don't know if we can, the only way we could reconcile all of this angst and anxiety and isolation and loss is through love. And at the end of the day, it's a divine gift, I think.
No, absolutely. And in fact, it's funny, the church that I go to and my family goes to just started meeting in person again without any restrictions. And thank God for Zoom because, you know, I went to one mass one time with a mask on. I said, I'm not doing this again. It was so distracting. I couldn't hear the message from the pastor. For at least for me anyway, I couldn't get in tune with what was going on, and kind of made it a worthless exercise for me personally. So I found that while doing a mass through Zoom wasn't ideal, I could focus on the message a lot better than if I was there in the church, focused just on this piece of cloth on my face and not what the priest was saying. So yeah, I get that. All right, and now we're going to direct the next question to Pastor Anthony. And that would be, how do we deal with loss during the storm? In parentheses, many deaths for a long period of time. That's how we're defining the storm, without family and loved ones around us.
I believe what Dr. Benjamin was just saying, love. I mean, love is the answer. And, just simply, because we have to provide and create a sense of family. I had, situations where some of the guys that I mentor, one was dealing with a situation where he thought his mother would die in the hospital. And I felt helpless, but I began to look at the basic needs, food, shelter. How are you doing with food? They didn't have food. And that happened with about three or four guys, being willing to reach in our pockets. And, and in one situation, I got in trouble, and this is good trouble. A campus situation was where one of the guys came to me and said, I'm hungry. We haven't eaten for 4 days. And I was broke. I'd already given everything. And I was part of a committee, restorative justice committee that, we had been working with and working towards equity on campus. And I made an appeal, and later found out that I wasn't supposed to, because it was an appropriate use of funds. But love gives at the expense of self, and oftentimes love means that we do whatever is necessary to sacrifice. And I think just having lived in firsthand experiences with a lot of young men who were right in the middle of the storm, I felt absolutely helpless because, what do you do? What do you do? And I mean, when they're crying out for help, we don't always have the answers, but oftentimes, the answer is a whole lot simpler, than one would think. It's not complicated. It's never, we make things complicated, but they are not. And I agree, love is the answer. And I think through just asking simple questions like, how can I support you? What do you need today? Is there anything during the pandemic? And I'm not sharing this to in any way pat myself on the back, because in most of the cases I was in tears. I realized it was not about me. It was really finding solutions. But the innovations of sending groceries over, or or fundraising, raising money. As a graduate student, you can imagine. I don't have a lot of money. Very little. But I can tell you, it was one of the most rewarding things, because at the end of the day, I'm not Jesus, and I'm not able to heal or bring anyone back from the dead. I mean, that's not in my um, uh, skill set. But we are able to revive, and we're able to love. We're able to wrap our arms around, and if nothing else, to say, listen, I don't have any answers, but I'm here, and whatever I have is yours. I think St. Paul said it best. He said, we love you so much that we share not only the gospel, but our very lives. And so it comes back to love.
No, exactly. And it's interesting, you said something that really kind of resonated with me, and that is, you know, complicating things. And there's nothing like the human mind that can often get in its own way and complicate things. And in a previous life, I was a consultant in the high tech field. And it always struck me sometimes as how people would complicate their needs with a long list of wants. And oftentimes it wouldn't be clear is what they really needed. And it was a skill to develop to be able to kind of drill down and say, I hear what you want, but what do you really need? What are you trying to do? What are you trying to solve? And I think that can be applied certainly in this space. So thank you for that. All right, I'm going to go back to Reverend Hiram and ask the next question, which is, are gratitude and spirituality protective factors against emotional distress?
Yes, thank you, Thomas. I really like the conversation on love, and I'm a big person who captures quotes and whatnot. And as you were talking, it reminded me, of this quote by Tolstoy talking about love, and it's love is life. Everything that I understand, I only understand because I love. Everything exists only because I love. Everything is united by it alone. Love is God. So I think that that's such what has been shared before in terms of how important love is. And I think Dr. Doolittle, working in the emergency room in the chaplain, you're coming to situations where people lose their loved ones many times, and you can see the grief that occasions the loss of a loved one. And as he said, it's really it's two sides of a coin. Those who love deeply grieve deeply, and they're the same side of the coin there. And so, just wanted to lift that up. I think that I do think that gratitude is the elixir of life. That gratitude is what really makes life go, and that it is such an important factor in our lives. And gratitude is a portion of spirituality. Again, I've been in situations and talking to families and patients in the emergency room in the hospital, and often those that have a sense of gratitude, a sense of faith, a sense of spirituality are able to manage their emotional distress much greater. Just recently, I was talking to a young man who was of faith, and his mother was very ill and not expected to make it. And what he said to me was that he was glad he had been able to make it from Indiana to the hospital, and that he was grateful that she had told him that she was proud of him 4 or 5 days before. And so I think that gratitude is something that we can all incorporate in our life, and the more that we see And that's something from 2021, that's something that I've been trying to have a broader vision, to see more, so that I can see all the things that are blessings to me. And so I guess to answer your question more succinctly than I have so far, yes, I think that those are protective factors against emotional distress. Thank you, Tom.
Thank you. And yeah, I think that I'm grateful for my faith, because I think my faith has helped me manage my emotional distress with some of the fallout from this pandemic. I've been fortunate that I didn't lose anyone, but I knew other people who were close to me who did. And depending, I think, on sometimes how strong their faith is, it allowed them, if their faith was strong, to manage that emotional distress without being overwhelmed by it. And again, I think they were grateful for that, because without it, you could really lose yourself in the grief sometimes. So yeah, I appreciate that. All right, we're going to go over back to the rabbi, and this question is for you. What is the role of gratitude in spiritual well-being?
It plays such a constant role that we sometimes forget. You know, I was talking about, you know, one of the problems I had over this COVID thing is that, you know, people had networks of love that COVID completely destroyed. They weren't able to touch each other. They weren't able to see each other. You know, that everything was, you know, everything was with a screen in between. And it was really, really hard. And people, you know, and without that, what love to bolster them, things began to, you know, pile up and in all kinds of really, you know, bizarre ways. And one of the ways, you know, normally that when our problems pile up, we turn to someone we care about. We turn to someone who cares about us, and we sort of, you know, hold hands and start climbing this mountain of trouble together. And when you get over it, you look back and you realize that it was just a speed bump. It was just it was just an optical illusion. It looked like it was a big pile of troubles, and it really wasn't at all. But when you have somebody with you to encourage you and to help you get over, COVID robbed us of all that. You know, one of the things I like to do is sometimes I'll hold up a blank sheet of paper with a little spot in the middle of it. And I'll say to somebody, what's this? And they'll say, it's a spot. I said, no, it's a perfectly good piece of paper it happens to have a small dark spot on it. I said, you know, we see these big problems, you know, but we don't see all the white, all the good things that are around us. And that's what gratitude does. Gratitude gives us a chance to stop and sort of, you know, list out, you know, I mean, there's all this good stuff that happens to us. And yeah, there are tough times. And yeah, there are some really, you know, life is hard sometimes. But, you know, when you look at the grand balance of it, we come out with so much more. I often tell families when they're grieving, I say to them, you know, that tears are just the price you pay for loving somebody, that you don't cry for people you don't care about. You know, and I say, you know, now that somebody has died, you feel like you're paying this humongous price. I said, but given all the years that you had together, you know what I mean, that you really have a lot to be grateful for. You know what I mean, that, you know, that, yeah, it doesn't take away the pain for right now, but as you go through, you'll be able to see how much you really do have to be grateful for. So gratitude is what sort of binds it all together. Gratitude is not just during COVID, but all the time. I mean, when we're grateful for everything, or for as much as we can be grateful for, the bad stuff doesn't count as much. When we look at blessings, you know, the bad stuff is inconsequential.
No, I agree. And in fact, I know in the mental health world, we use a thing called cognitive behavioral therapy with individuals who do have trouble sometimes seeing the bigger piece of paper and not seeing that small dot as a huge impediment to whatever it is that they need to do in their lives. And
it's an optical illusion, and you don't realize it until you're past it. And being with people who care about you can help you see that faster. Doing it alone is very hard.
No, exactly. Thank you for that. All right, I'm going to go over to Dr. Ben. And your next question is, what did you learn during the COVID crises. And as a doctor, I imagine you learned a lot of stuff.
Well, yeah. Well, the first thing is that everything about COVID that we all heard all of it is a little bit true and a little bit untrue at the same time. And I guess what I mean by that is the importance of wisdom amidst knowledge. And by that, I mean, at the beginning of the pandemic, we had a list of medicines and everybody got these medicines. And guess what? One of those medicines was hydroxychloroquine, which, that was true then, but then it quickly became untrue, right? So knowledge, what you knew, changed, right? In the beginning, we didn't know if face masks were going to be helpful or not, or there were a bunch of other medicines, steroids, no steroids, tocilizumab, no tocilizumab. Now ivermectin, which is an parasitic drug, we think makes a difference. So the truth changes, right? The facts change. And by truth, I mean lowercase t, truth. So amidst all of that, we needed wisdom. And in my opinion, at least from the top, we didn't have a lot of wisdom. We had shifting facts. And it makes me realize that, some of us live a fact-based life and some of us try to live a wisdom-based life. And if we tried to hinge our meaning and our comfort on facts, well, every day was different and it led to anxiety. And somehow if we could live our days steeped in wisdom, it seemed to help. That's my 2 cents on that.
Yeah, no, it used to crack me up when you'd hear people saying, follow the science. And it's like, which science were you talking about? Because it seems to change on a weekly basis. And all I'm getting is a headache trying to follow all this stuff. So you're well said in trying to substitute wisdom for facts, because wisdom will hopefully not steer you wrong, but the facts can be somewhat squishy sometimes, and especially in the mental health world, we know that very well, because there's still so much we don't know about the way the human brain works, and trying to, even correctly diagnose someone sometimes is a real challenge. And, I've met many, many people who have been misdiagnosed and, given a course of action that didn't help them. And I don't think anyone had any malice, but it's just because it's an inexact science and there's still a lot we have to learn. So, yeah.
Yeah. And it was exactly right. There's no malice. It's just what we learned changed over time. Yeah, indeed.
Exactly. All right. We have one more question, and I'm going to pose this to Pastor Tony, and that is, please share a positive message for the future. And I'm actually going to come back to all of you to share a positive message for the future. So Pastor Tony, you can go first, but I'm going to hit everyone with this one.
Positive message for the future is that we realize that we are resilient, and if we stay connected, we can get through anything.
I like that. Thank you. All right, Reverend Hiram, a positive message for the future.
Yeah, I think resiliency is certainly a key message for the future. I mean, I guess I'd like to share a couple of quotes with you. Brian Stevenson, who's Equal Justice Initiative president, and he writes, I'm persuaded that hopelessness is the enemy of justice, that if we allow ourselves to become hopeless, we become part of the problem. I think you're either hopeful or you're the problem. There is no neutral place. I think hope is our superpower. Hope is the thing that gets you to stand up when others say sit down. It's the thing that gets you to speak when others say be quiet. And just to close, since of time, one of my favorite quotes is from the Dalai Lama, who says, "Never give up. No matter what is going on, never give up. Develop the heart. Too much energy in your country is spent developing the mind instead of the heart. Develop the heart. Be compassionate, not just to your friends, but to everyone. Be compassionate. Work for peace in your heart and in the world. Work for peace." And I say it again, never give up, no matter what is happening, no matter what is going on around you, never give up. So that would be my message to anyone that I talk to every day, is just never give up, because things change, but we have to continue to go forward and begin again. And if we do that, we can do that with joy.
Yes, very much so. And what's that old expression? A man can live 2 weeks without food, about 3 days without water, but not a second without hope, or something like that?
Yeah.
Yeah, exactly. All right, Dr. Ben, share us a positive message for the future.
Well, this is going to sound very superficial, actually, but it's not meant to be. But you remember the Roaring 20s? I mean, none of us were alive in the Roaring 20s, but somehow I imagine, a jazz club, flapper dresses, zoot suits, moonshine. And that's what I want to do. I want to learn how to line dance and sit on a patio with my friends and have a cold beer. I want to see my nieces that I haven't seen in a long time and nephews and give them a big old hug, because we can do that now. And that's my vision for the summer, I guess. Zoot suits, flapper dresses, and some moonshine.
No, my hope is that people will realize that too many of us took that all for granted pre-pandemic, and we shouldn't ever, and especially the people in our lives. And maybe that was the message in all this at a very high spiritual level, is that, we depend on the people around us and those connections, and life is really dark when you don't have that. So I appreciate that. And I almost skipped over you, Rabbi, but I did not. So you can close this out here in the Q&A, or the question part, before we go into the Q&A, and share a positive message for the future, please.
My positive message is never, ever forget that God loves you. As long as you know that, no matter how bad things get, that redemption, that healing, that whatever may be, that God's always nearby. It's the old story, that just when you think that God has abandoned you, that's when you know that God is carrying you. That God is always closer than you think, and you just have to just carry through. Sometimes God needs your hands, sometimes God needs your feet to help others, and maybe even to help yourself. But sometimes there are things that you can do, and sometimes when you think that there's nothing you can do, you find the strength, the courage, the hope to overcome it, get past it, and find your way forward. There's always a way forward. You just have to believe.
All right, I agree, and thank you for that. All right, at this point, we're right on time, right on schedule. So I'm going to switch over to the Q&A, and I'm going to see if anyone posted anything in the chat here really quick. And since we have a relatively small group here today, for whatever reason, but the people who were meant to be here are here. I always believe that. So if you want to, I would say just unmute yourself and shout out whatever your question is, and we'll do our best to get an answer. And again, I'm just checking the chat to see if I missed anything here.
I have one question, Thomas, when we are checking on the chat. So during this crisis, so I think we still are on, right? So you have the vaccine, you have people, we change our behavior, we learning wear mask, we did all this kind of thing. We grow together, you're learning together. We went through so many different emotions. And one thing that I have been listening to from different conversation is this idea also to give back. So for professionals, for not only mental health professionals, workers, but all the workers, all of us that continue to working, continue to trying to find ways to keep connect. In that point, we share this experience. In your point of view, do you think that we as a human being, we will end this experience? If this experience one day will end, I'm not sure, but how will we went through? What are the most important thing that we can take for us, for our life? So do you think that the humanity will come out of this pandemic better in terms of important things like solidarity, like take care one each other, about respect, about pay attention in learning what the science has to say to us in different ways they work. Be patient. So do you think that we will learning things like that? Do you think that humanity will be better? So what is your point of view as a doctor, as a social worker, as a pastor, reverend, as human being? So when you have these conversations at your church, at your community, can you share what people in terms of well-being, in terms of learning, so what people sharing with you? So how you can see yourselves in a different position? Are you have a better mirror? So are you looking to yourselves in a different way or not? And this is for all of you.
Well, we lost Thomas for some reason. He told us that his internet was a little shaky. Look, things we can learn from all of this, things we can carry forward. One is never underestimate humanity. We have proven that science is important, but so is our wisdom, so is our ingenuity. We found ways to pull ahead. We found ways this was just a tiny little virus that was everywhere, and we found ways to hold it at bay long enough till we could bring vaccines and treatments and everything. I said from the beginning, when you have a disease and nobody else has ever had, everybody's going to get it. But the trick is to get it as late as possible. The longer you waited to get it, the more likely it was that we would find our way through it. And we can always rely on people, to get down and get to work and make that happen. We're always growing. We're always learning. We discovered that when everything else failed, we read and learned, and from the scientists, from the doctors, and from everybody. And then we had to put that together in using, as Dr. Ben said, the using our wisdom to sort of fit it all together in a good way. And the final thing I think we're going to carry forward is that the small things are far more important than we ever thought they were. You know, a simple hug, just holding somebody, seeing grandchildren, seeing our own kids, being able to gather together with friends, little things like that turned out to be a lot more important than we ever thought they were. And I think that none of us will ever take any of that stuff for granted again.
Thank you for your answer.
I would agree with the rabbi that small things have taken on we've taken a great appreciation for the small things, and those small things are the ingredients that really make life worthwhile. As I was thinking about your question, I mean, I think that I sort of look at us, humanity. I think you started your question with. I think I look at humanity as being a process of continued kind of growth. And so I think that at this point in time, I'm very much a person who believes in living in the now. And so doing what we can do now. So I'd say that I think that if we do what we're called upon to do now, to be the best human beings that we can be, that's all that we can do. And because we'll plant the future for future generations to lead on and do their thing. So I'd say that I have hope and I have faith that if we do what we are called to do, that God's great creation will continue. We can't see what it will be, but we're called to, in the moment that we live, to do our part. So that's how I kind of relate to the question. Thank you.
All right, and I'm glad to be back, folks. My machine just crashed, which it has done about 3 times since I've owned it. But of course, I'd have to pick right in the middle of a meeting to do it. So I apologize for that. I've also lost the chat, so I don't know if anyone had posted any questions in the chat. But if you could re-ask them, that would be great.
I did it. We are looking for the chat, and we have 2 questions. We are in the question 1, and I would like to thank you, Thomas. I would like to ask if you, Ben and Anthony, you have something to add to this first question.
I am. I don't see the question. Can you help me out?
Yeah, so the question is, do you think that people will grow through the situation, learn more about solidarity, to take care of each other, to be more helpful, the lessons that you learn from science that take time, so be more patient, be more awareness about we need to go through this together. It's a collective effort that you need to do. So, or do you think that humanity just will be the same?
No, I think we're forever changed, and I think honestly, when you go through a crisis, your DNA change. PTSD has horrible after effects, but the positive parts of that, and I share this as a veteran who's served in 3 branches of service. You walk away with relationships that are deep and at a level that you never would have imagined. In one situation, you're with people that you can barely stand, but you go through something traumatic and that changes everything. Now they become family for life, and I believe in the same way. While most of us do not have the background of Dr. Benjamin here, and others who are scientists, but as human beings, what we understand more than anything else is, man, we got through this together. We're still here, and Rabbi Randall, mentioned that you no longer take for granted the small things, as well as I think Reverend Brett, a hug, a touch. Dr. Benjamin mentioned simple pleasures of a beer, sitting and enjoying that, or being able to return to church and embrace each other. And I have a picture that I want to share of the guys getting together and being able to actually hug without the mask and play basketball. And that picture just says it all. I mean, they love getting together. And also, I wanna share just in case this is shared. I'm sure I transitioned out of being MBK director because it was part of my graduate project. So someone else is now taking on that role, but I look forward to continuing to mentor and do other things. And I just wanted, fair disclosure, wanted to make sure that that was shared. But that's my perspective.
Yeah, I guess I'll chime in here. Boy, I wish that humanity will emerge from this pandemic all the better for it. I'm not sure. History shows that after each of the pandemics, the flu pandemic of 1918, 1919, the Great Plague of the Renaissance, over and over, Napoleon's typhus epidemic in his armies, on and on and on. There's a shift, if you will, but I think during these moments of great strife, our true character emerges, both the good and the bad. And so there were noble sacrifices and healthcare workers, family members reaching out to neighbors. But let's face it, folks, this past year was one of the more divisive, politically divisive, racially divisive. There was so much injustice. When you look at who died from COVID, who got infected with COVID, it was people who lived in poor neighborhoods and racial minorities. So there's a lot of injustice that this pandemic revealed in a new way. And, when George Floyd was murdered, the New Haven exploded. We shut down I-95. We shut it down. So, January 6th, we're going to remember January 6th. You just say the date, like 9/11, right? We all remember. January 6th, a sitting president urging people to take over the Capitol. I mean, I think this pandemic brought out the best in us and brought out the worst in us. at the same time. And I think we're still in the middle of reconciling what this means for us. Because, from a Christian perspective, it's we live in a broken world, a sinful world, and we're saved but by the grace of God, because when we're left to our own devices, so often so often it's the powerful who grab more power, and the poor who are left struggling once again. I hope this time it's different. I'd have to say, I don't think so. That this pandemic brought out the best in us than the worst.
And there's something to be said for the focus as well, because I think there are certainly a lot of examples of the best of us, but you're absolutely right. There was also some things that were just completely over the top in the other end of the scale. So certainly in the mental health world, we always do try to have people try to focus more on the good stuff, and certainly be grateful for the good stuff in their lives, because ruminating too much on the negative stuff leads to madness. It really does. And it's not easy to do sometimes, and especially when it's right in your face. But hopefully we will, as you said, Dr. Ben, hopefully we will come out of this stronger and wiser, stronger in our faith, and have that wisdom that was spoken about earlier.
And speaking of the positive, I'd like to take about 5 seconds and just share the picture that I mentioned.
Please.
Okay, I have. Okay, I'll share screen here, and this is. Wait a minute. Okay.
Is this the guys playing basketball?
Yes.
All right.
Hold on a second.
While you're doing that, if you want to just formulate some final words, because we are coming up on the bottom of the hour here, and I'd like to give our 4 panelists a chance to just say a closing remark, if you have one. Look at that. Wow.
Yeah, this was the picture, of them just being able to get together and play basketball without the mask. So I just wanted to share that.
Anything that you'd like to add in closing, Pastor Martin?
I think I want to just say, Dr. Benjamin has certainly given us a sobering assessment of the realities of this, and I'm also hopeful that though not all, but some of us will come through your change, and hopefully with outreached arms, and in the same way in the picture I just shared of us coming together. And and I share that with the fact that I know and understand that most of us were the ones affected, because these were the guys that I looked after during the pandemic. Some who were isolated and didn't have, and it was horrible. But at the same time, I am hopeful.
I appreciate that. Thank you. All right, Reverend Hiram, any last words you'd like to leave us with today? Oh, you got to unmute yourself.
Yeah, I'd just like to thank everyone for the opportunity to be on the forum. And I hear what you say, Dr. Benjamin. Desmond Tutu says, hope is being able to see that there is light despite all of the darkness. And so I would just leave us with that we need to be hopeful, that hope will lead us to a place. We need not to be ignorant or ill-informed about the reality, but I think that our hope and our drive and our commitment to living out the ideals of our faith will make a difference. And I think that as we commit to that, we can make this a better world for everyone. So again, thank you for the opportunity to be a part of this.
Absolutely. Thank you. Dr. Benjamin, any last thoughts?
Well, after the sobering assessment, I still think, we have each other and we have God, and God doesn't let us down. And so, if things aren't right, it's because the story isn't over. And so we're still in the middle of the story. I'll leave it at that.
All right. Thank you. All right. Rabbi, take us home.
We're all connected in ways that sometimes we don't even know. That you never know when something you say, something you do, something that you pass off as just a blip in your life can have extraordinary repercussions, to other people, not in terms of bad things, but even good things. That people remember the good that we do, long after we've long forgotten it, and that will happen here too. The devastation of this plague will fade into memory like the last plague did. But the good things that people have done, the good ways that people reacted, the things that made a difference, those will stay with us, I think, for a very, very long time. And I think that that's really important. I do need to add, though, I just got a text just this second that a woman, not from my congregation, but a woman that I know, just let me know that her husband and her father-in-law were in that building that collapsed in Miami. They're still unaccounted for. So if you
I
got
hadn't
any
even
prayers
heard
out
about
there,
that.
it's I said we're attached in ways we don't know, and it's something that's far away, and yet it reached up to Connecticut all of a sudden, and so this is what we do.
Yeah, I hadn't even heard that story. When did that happen? This morning?
Happened overnight last night, 1 o'clock in the morning. Half of a building collapsed on Miami Beach.
Can't even
In the
imagine.
middle of the night, which means that everybody was home, right? 1 o'clock and 2 o'clock in the morning means everybody was home, and then they don't know why it collapsed. They don't know how it collapsed. They don't know. They're still trying to sort it all out. But right now, it's a search and rescue. Right now, they're just trying to find whoever still might be trapped in the rubble.
Well, hopefully some people will have made it through that. So thank you.
I appreciate the prayers. I very much do.
Thank you. And I want to thank our panelists today, the Reverend Hiram L. Brett, the Rabbi Randall Konigsberg, Dr. Benjamin Doolittle, and Pastor Anthony Martin. Thank you all so much for taking the time out of your busy days, taking the time to share some of your wisdom with us this afternoon. And I really, really appreciate that. Graciela, is there anything else you want to add before we let everyone go?
I just want to say thank you very much. How a wonderful conversation. Our next panel about spirituality, COVID-19 and faith will be on July 8th. Please share with your community. We are glad to hear from you, your feedback. So we will be receiving in your email a survey. So what you have to say to us matter. So we would like to hear from you ideas and how this conversation was going. And I would like to thank you so much. And I hope to see you again on July 8th. Thank you very, very much. And please be in touch.
Thank you.
Thanks, everyone.